Hey everybody, welcome back to our YouTube channel. My name's Ashley Agan, and this is my little sister, Alix Agan.
Hi.
And we have a direct care ENT practice in Dallas, Texas. I'm the doctor, she's the
handler.
handler. Alix does everything from all the back of the house stuff. She's going to be the one you talk to when you call. She takes care of getting everyone's orders in and surgeries arranged, and she's like the magician behind the scenes. She does all the really hard stuff. But we have a direct care practice in Dallas. It's called Scottie. It's named after our grandmother, Shirley Ann Scott. Her nickname was Scottie when she was a kid, and so she passed away a couple of years ago after a very long battle with cancer. And when I was starting this practice, I thought, what better way to honor her than to name the practice after her? So Scottie was born, and today we are going to talk a little bit about ear tubes, which is a really common thing that we see come in. And let's see here. Alix, you want to kick us off? You're the first line of contact when moms or dads are calling in and asking about ear tubes.
Yeah, and I guess I would also mention that adults also get ear tubes.
True.
Which is something that I didn't really
realize
realize before I got into this world. So patients will, or usually moms or dads of patients will call, and they'll, their kiddo has had recurring ear infections, and they're just really fussy. They're tugging on their ears. They're maybe having delay in speech, and they're just kind of getting concerned and probably not sleeping a whole lot. And so,
which means mom and dad are not sleeping a whole lot.
Exactly. So, they're looking for alternatives. Yeah.
To the call.
And for us, since we don't contract with insurance, we have the ability to see them, within a few days of them calling in. So they're not scheduled 5 or 6 months out and dealing with 3 or 4 additional ear infections before they see us. So,
Yeah. Recently we had a family that called coming in from out of town. We were able to get them on the schedule for their ear tubes within a week, right? From phone call to on the schedule. So super fast turnaround.
Yep.
Ear tubes are interesting because they are probably the most common surgery performed in the country. If not the most common, then definitely one of the top. And the traditional way to do ear tubes is in the operating room, and that is because we will use a little bit of general anesthesia to help keep the child still while we use a microscope to look in the ear canal and place those tubes. So it's microsurgery. Everything is very tiny. So you need to have the child still to be able to make those small movements. But the facility fee for that can be really expensive. So if you or your family have a high deductible insurance plan, and the facility fee is $8,000 to $10,000,
yes, and
just
very
for the
commonly
facility,
that much.
We've gotten lots of calls about that. Then you're kind of emptying your savings account just so your child can have ear tubes, which is really a horrible place to be in as a parent, to be making that decision about kind of your financial security and what your child needs. And so we do work with a surgery center that specializes in bundled pricing, and we're able to do ear tubes for $3,500-ish, somewhere in there, for all of it total. So for the surgeon, anesthesia, facility, all of it. So if your child needs ear tubes and you're being quoted something more than that, then you should come see us or call around and look for better options in your area. And I mean, $3,500 is still a lot, but it's less than
compared to what
8.
some people are getting quoted.
Yeah,
It's reasonable.
Yeah, and the other cool option that we have available in our clinic that we specialize in is office ear tubes. And so I've been putting tubes in adult ears in the office for years, and it's because adults can sit still. and you can talk them through the procedure, and you can tell them, okay, now you're gonna, feel a little bit of poke on your eardrum, and you can. And some adults still like to go to the OR, but typically it can be done in the office. And now we have a couple of devices that allow us to put ear tubes in the office, and so that's been another big thing that parents are excited about and calling to schedule, which has been really cool.
Yeah, and it's been a really good option for families that are wanting to avoid general anesthesia. The whole process from start to finish, I mean, if the kid is cooperating and it's, everything's going well, it takes 5 to 10 minutes, and then they're usually, by the time they leave, they're like happy and ready to go get ice cream or a burger or something.
The kids don't have to fast.
Yeah, no fasting.
There's no anesthesia. They don't have to fast. And the parents get to be with them the whole time, which I think for some parents, that's another big reason to want to do ear tubes in the office, because if there is any sort of distrust, like with the medical community, or if there is just anxiety about being separated from the child, then office ear tubes might be a good option, because you get to stay there. You're there with your child the whole time. Typically what we'll do, the entire time, start to finish. We will swaddle, like for the very young babies, we'll swaddle them. I have an assistant that helps hold the baby's head still. The parents are usually sitting across on the other side, and will either sing songs, or they'll have a tablet with a movie that they'll play. Their job is to kind of help soothe and distract the little one while we get the ear tubes in, and we switch sides. And then, like Alex said, usually 3 to 5 minutes in the best case scenario. With the older kids, typically it's going to just depend on their temperament, because you can't swaddle them and hold them down. So every child is different. I've had, I think the first one I ever did was on like a kid who was like 6, and he was just able to, we talked him through it, we let him know what to expect, and he was able to hold still. I've also had kids of a similar age who were not able to do it, and so I think that for the older kids, it very much just depends on the temperament of the child, but it's a great option to have, so that it is slightly more cost effective, and being able to avoid general anesthesia has been very attractive for some families.
Yeah, and I think too, one of the cool things that Ashley offers is a free virtual 15-minute, not a consultation, but it's just an opportunity.
We call it a meet and greet.
Meet and greet, and it gives them an opportunity to kind of talk through, the OR versus in-office ear tubes, and kind of what's the child like? Is it hard to dress him in the mornings, him or her in the mornings? Are they pretty chill? And those questions that she's able to answer kind of help guide the parent to the best option for their kid. And both of them, they leave with ear tubes, so it's really just what works best for the family.
Right. And I've had some families who tell me that office ear tubes were great for one of their kids, but they know that it wouldn't have been a great option for the other kid, just based on the temperament and kind of how that child is. And so it's just another option. And like Alex said, we do the virtual meet and greet so that we can chat about kind of some of these questions about what is right for your child, and what do we recommend. And for some patients, it also just gives you a chance to meet me. We do that with all of our appointments, whether you're getting ear tubes or not, because not everybody has ever had an appointment with a doctor who's a direct care doctor, where you're not using your insurance. And so I think for some patients that can be kind of a little bit scary, like, oh, I'm gonna pay out of pocket and not use my insurance, and what if it's not a good visit or something like that. So it gives us a chance to talk and to help you know if it's going to be a good fit. Or for me, sometimes I might tell you, actually, I don't treat that condition anymore, and maybe I might recommend another doctor for you, and that way you don't waste your time making an appointment, coming in, only for me to say like, oh, I don't do that. So I think it's helpful too.
Yeah, and I think it gives patients a little bit of a sense of control again in the medical field, in the industry. It can feel kind of like you're being either passed around to different doctors and just seen for 2 minutes at other offices, and getting to just kind of see you and just a quick, this is what's going on, tell me more about direct care, how is it different, is it worth my time, is it worth the effort of scheduling, and I would say 9 times out of 10 it gets people to come in and see us because they, we're able to kind of gain their trust just by talking to them and letting them know they're a person.
That they're going to be seen. I think one thing people kind of one of the initial reactions when people think about like, oh, I'm going to pay $350 for a new patient consult, and then they think about other experiences that they've had with other doctors, which usually involves waiting in a waiting room for at least with a bunch of lots of other patients for at least 15 to 30 minutes, sitting in an exam room waiting, having a busy doctor or provider come in, spend 5 to 10 minutes with them, and then leave. And people think, why would I pay out of pocket? I have insurance. It's bad enough experience using my insurance. Why would I want to actually pay out of pocket? And the answer is that it's a totally different experience. You're paying to not have to have the other experience. So our patients typically, come in. We try to schedule it so that they are waiting as little as possible.
I mean, half the time they don't even sit down. Half the time we're in there and they've been seated in the consult room before they even had an option to sit in the waiting room. And if they do wait maybe 5 or 10 minutes, or if they wait, it's because they came super early because they weren't sure. It was their first time coming, so they wanted to give themselves plenty of time to get here. And if they are waiting, then we have beverages. So we've got water and tea and sparkling water. And usually it's a very quiet waiting room. It's not super busy and bustling. And so it's good music playing as well.
Alex is the DJ. It's just a totally different experience. So if you've never, done direct care or kind of went outside kind of typical traditional healthcare with insurance, you're paying for a totally different type of service than what you're used to getting. And so I don't think everyone realizes that when they're thinking about having to like pay out of pocket, which on the surface might seem like a negative thing, but actually I think once you experience it, it's actually just you get what you pay for, I guess.
Yeah, and we, part of my background is in hospitality, so we want to connect with you guys and all of our patients, and we want to remember, your kids' names and your, that you just had an anniversary that you just celebrated, or you just got back from Italy, how was Rome? It's just those things that kind of help just have a human connection and not transactional, I think is really what we are also providing, which is something that most patients aren't getting elsewhere.
Right. Yeah, I would say over and over again, we hear about patients having a bad experience somewhere else.
Unfortunately, we hear that a lot.
Yeah.
It's
too much.
Yeah.
It's kind of depressing how common that is, whether it be with the provider that they saw or with the office staff that they were working with to try to get their records or to try to get scheduled, or a patient today was telling me that they were in a lot of discomfort and called to get scheduled somewhere, and they told them that they would see them in essentially almost 2 months, and there was no compassion for the patient's condition and trying to get them seen sooner. It was just kind of too bad.
Yeah.
So we are trying to be the antithesis of that.
Yes,
and to take really good care of our patients. And it's more fulfilling from our standpoint too. I feel way more energized and way more fulfilled in this type of practice than I did when I was trying to see 25 to 30 patients a day, because I have time to slow down and listen to my patients and really just spend more time with them and give them a better experience, make sure that they feel like they know that we care about them, and that we are going the extra mile. And so it's just better.
Yeah. Feels good.
It does. It does. So if you are looking for an ENT, whether you're in the Dallas area or not, we have people who travel to see us all the time, and they always say that it's totally worth it.
Yeah.
Dallas is really easy to get in and out of. So come down and see us.
Yeah,
Experience
and
it
there's
for
some
yourself.
fun like pockets that people that aren't from here don't know we're here, and that's where we come in. We can give you the.
I'd say that's all Alex. She's in charge of the.
I have a full list
of the dining
of
guide.
where to dine, where to get a good cold Miller Lite, whatever it is. We've got a resource one pager that we like to give to our traveling patients, because we want you guys to have a good time while you're here as well. And it's not just it doesn't have to be a drag to come see a doctor.
Yeah, I think it can be, when you're going through some sort of medical problem, especially if you've already seen a few specialists and the answer seems to be eluding everyone and no one can kind of figure out what's going on. That can be really stressful, anxiety provoking. It can be scary to go to yet a new doctor to kind of be like, okay, is this doctor going to know what's going on or know what to do next? And so I think as much as possible, we're just trying to make going to the doctor a little less, uncomfortable and scary.
Yeah.
So cheers to that.
Cheers.